Imagine needing life-saving medical care, but hesitating because you can't afford the cost. Now imagine the same care is completely free, but you're told you'll have to wait 6 months to receive it. Which situation would you rather be in? The truth is, both of these realities exist today, but in different countries. And in the United States, we're stuck in a system where millions of people face the worst of both: high costs, limited access, and inconsistent coverage. Whether you're on your parents' insurance plan, you pay out of pocket, or rely on Medicaid, healthcare affects us all. It'll affect us financially, physically, and emotionally. And after researching both sides of the debate, I found a solution that doesn't force us to choose between care and cost: a hybrid universal healthcare system. Today, I'll first explain the problem in our current system, then I'll show you how a hybrid model works and why it's effective. Finally, I'll help you visualize the future we could create with it and what you can do to help make it happen. Let's start with the problem. Our current healthcare system is broken. Over 25 million Americans are still uninsured despite reforms like the Affordable Care Act passed by Obama. That's millions of people who avoid going to the doctor, skip prescriptions, or go bankrupt trying to pay off hospital bills. Medical debt is the leading cause of bankruptcy in the US, and even insured individuals often face high deductibles, surprise billing, and restricted access to care. People without access to regular doctors often will wait until a crisis hits and end up in emergency rooms, costing taxpayers and further overwhelming our already strained system. And even with all this spending, we still lag behind other developed nations in life expectancy and preventable disease outcomes. So if our current system isn't serving everyone fairly or efficiently, what's the alternative? This brings us to a hybrid universal healthcare system model. In a hybrid model, the government provides basic healthcare services like preventative care, primary treatment, and emergency services to all citizens. At the same time, private insurance companies remain available for those who want faster service, premium options, or specialty care. This model guarantees access for everyone, so everyone gets access, while preventing freedom of choice from being infringed upon. You're still able to choose your own insurance if you have the means to. And it still allows for innovation that's driven by private competition. Countries like Germany, France, and the Netherlands have already adopted this kind of system. They've proven it's possible to balance equity and efficiency. Healthcare expert Karen Davis, writing for the American Public Health Association, states that universal healthcare coverage improves outcomes and reduces long-term costs by focusing on early intervention and prevention. Economist Mark Shepard, in a 2023 article for the American Economic Association, points out that even strong market-based reforms in the US leave about 10% of people uninsured. That's that 25 million from before. 10% of people uninsured. Proof that we need more than just tweaks to the current system. A hybrid plan is a fair and balanced solution that respects individual choice while fulfilling our responsibility to care for one another. Now let's imagine what our country could look like with this system in place. Everyone would have access to basic healthcare. No more worrying about how you'll pay for a checkup, a hospital visit, or life-saving medication. People who want faster service or additional perks could still choose private insurances. The system would reward innovation, but without leaving anyone behind. That means the private companies could still do their business without leaving low-income people without coverage. Families wouldn't have to choose between rent and medical bills. Small businesses wouldn't be crushed by the cost of employee health care. And doctors could focus more on patients and not on paperwork. But if we don't act, we'll continue down a path where healthcare remains unaffordable, inequitable, and unsustainable. That's why I'm asking you to take action. Learn about hybrid universal healthcare systems, different models, understand how other countries make it work, right? Because we all see it works in the UK, it works in the Netherlands, Switzerland, Canada a little bit. We need to figure out how it can work in the US. Understand how other countries make it work. Vote for leaders and policies that advocate for inclusive and realistic healthcare reform. So not just free healthcare for all, or something akin, realistic changes that can be implemented with some swiftness. And most importantly, talk about it. Talk, talk, talk. The more people that understand that this isn't about free healthcare versus private healthcare, but rather about balance, the more support we can build. In conclusion, our current system is flawed, but we don't need to pick a side. You don't need to be private, public, etc. We can build a better one, a better system, a hybrid universal healthcare system that offers a realistic path forward, one that covers everyone, respects freedom of choice, and makes our nation healthier and stronger. Let's move past the debate and toward a system that works for all of us. Thank you for watching.